Hello and good evening to Sir Eddie and my fellow friends. My name is Nobatrisha and today I'll be presenting on my assignment topic, which is stroke. So what is stroke? So a stroke, also known as brain attack, occurs when blood supply to the part of the brain is blocked or when a blood vessel in the brain bursts. So stroke can lead to lasting brain damage, long-term disability or even death. So, what causes stroke? So, there are three causes of stroke. So, the first one is a blocked artery, which also known as ischemic stroke. Ischemic stroke is most common type of stroke, which occurs when the blood vessels become narrowed or blocked, caused by the fatty deposits that build up in the blood vessels that reduce the blood flow. So the second one is the bursting of a blood vessel, or also known as hemorrhagic stroke. So hemorrhagic stroke happens when a blood vessel in the brain leaks or ruptures, and there are a few factors that are related to hemorrhagic stroke, which include uncontrolled high blood pressure or trauma. So as you can see in the picture that I put in the poster, so that is the situation how is the ischemic stroke and hemorrhagic stroke happens. So the third one is transient ischemic attack or TIA. So TIA also known as mini stroke. So TIA is caused by a temporary decrease in blood supply to the part of the brain which may last to 5 minutes. So TIA also occurs when a clot reduces or blocks the blood flow to the part of the brain which is the same as the ischemic stroke. So next is what can a person do to avoid having stroke or having another episode of strokes. So the first one is take your medicine. So if you take your medications, it can prevent to have another episode of stroke. So the second one is do regular exercises. So surgeons recommend for adults to have moderate intensity aerobic exercise for 2 hours and 30 minutes, while for children and teens to have physical activity for 1 hour. And the last one is the most important one, which is stay away from smoking. So smoking can make the plaque more likely to build up and thicken and narrow the blood vessels. So next I will be explaining what to do if someone is having a stroke. So there are 4 steps you can do, which is the first one is stay alert and calm. So the second one is help the person to lie down on their side with their heads elevated, but if the person is unconscious, do not move them. So the third one is try to lose any tight clothing of the persons that she or he wears. And the last one is check the warning signs of stroke. So and we can use the FAST acronyms, which stands for face, arm, speech, and time. So the first one is face. You can check is the person's face is numbs or does it droops on one side. So as for the arms, you can check if the person's arms are one arm numb or weaker than the other arm. Or the last one, if you ask the person's question, does their speech slurred or strange? So if the symptoms is yes, all of the symptoms is yes, so you need to call the emergency service immediately. And the last one is for a fun fact, which is, did you know during a stroke, nearly 120 million brain cells die every hour compared to the normal rate of cell loss in brain aging? During strokes, the brain ages every hour for 3.6 years without treatment. So if the sooner the patients receive medical treatments, the greater the chance of the recovery. And that is all from me, I think. Thank you.